going to be your nurse today. I'm just going to ask you a few questions if you're okay with that. What is your name?
Alyssa Ushman,
Okay, and what's your date of birth?
12696.
How would you like to be addressed?
Alyssa.
Alyssa. Okay, could you explain the reason of your visit today?
Oh, so I've been having a lot of ear pain lately. It hurts to touch it on the outside of my ear, and also it's I have a hard time hearing out of my left ear too, and I've been having some fluid come out.
All right. Are you allergic to any drugs or food or seasons at all?
No.
Seasonal? Okay. Do you identify with any gender?
Female.
Female. Okay. And what is your religion or spirituality?
Catholic.
Catholic. Okay. And what race do you identify with?
Caucasian.
What is your primary language?
English.
Okay. And are there any other cultural differences that I should know about while
No.
treating you? Okay. Could you tell me how you generally feel today?
I feel alright. I'm kind of sad lately because me and my boyfriend just broke up a couple months ago.
I'm sorry about that. Must be very hard. Do you suffer from any medical or psychiatric problems that I should be aware of?
No.
Okay. Could you tell me about your surgical history?
I had my wisdom teeth out a couple years ago. I got all 4 of them removed.
Okay. Anything else, injuries or fractures that I should be aware of?
Nope.
Okay. Are you current with your immunizations? All right. And when was your last TB test?
I got my last TB test in November, and it was negative.
Negative. Perfect. Could you tell me if you have any dietary restrictions?
No.
Okay. Do you have any problems related to eating?
Yes, I've been eating a lot more lately because I've been so sad, so I've been eating more.
Oh. Could you describe any changes in your appetite or weight?
I've gained 10 pounds in the last couple months.
Okay. Anything else? Your appetite, you've noticed an increase in appetite due to your sadness. Okay. How would you describe your oral cavity? What I mean by that is you're dry. Is it dry? Do you bleed when you brush your teeth? How are your teeth?
No, everything's good in my mouth.
Okay. Do you have any difficulty swallowing or chewing? Or do you experience nausea or vomiting?
No.
Are you aware of any history of your GI problems, liver, or endocrine problems?
No.
Okay. And could you tell me about your last bowel movement?
It was this morning.
Did you experience diarrhea or constipation?
Nope.
Blood in your stool? Okay. Is there any significant family history that I should know about, such as cancer in your family or anything?
On my dad's side, there's a history of heart attacks.
Okay.
In my family, so.
Okay. Do you consume alcohol, caffeine, tobacco, or any other recreational drugs?
I do not drink, but I do drink coffee every day.
Okay, just 1 cup or?
About 1 cup a day.
All right. Have you experienced any recent lifestyle changes that I should be made aware of?
No. I mean, I haven't been at work a lot lately because of I've been so sad, so my income is really low, so I've been kind of struggling with that too.
Okay. Do you regularly conduct a self-breast exam?
Yes, I do.
About how often?
About once a month.
Okay. Have you ever had a mammogram or a pap smear?
Yes.
Both?
Yes.
Okay. When was your last one?
My last one was last November when I got my TB test.
So mammogram and pap smear at the
Yes.
same time? Okay. All right. Do you use seatbelts?
Yes, I do.
Always or sometimes?
Always.
Always. Perfect. Could you describe your urinary patterns for me? Do you wake up in the middle of the night to urinate?
Not usually, no.
Okay. Do you experience any urgency or incontinence at all?
Nope.
Okay. Do you have problems sleeping or resting?
No. Well, I haven't actually been having trouble sleeping at night.
Mhm.
I've been having a lot of thoughts going on.
Okay. Could you describe your thoughts to me?
I mean, just being sad and I miss my boyfriend and stuff.
Could you tell me when your breakup occurred?
A couple months ago.
Okay. Do you use any sleep aids to help you with sleeping?
No.
Okay. And do you exercise and perform recreational activities?
I do try and swim about 4 times a week. However, because of my ear pain and a lot of stuff has been going on in my life, I haven't been exercising as much. This is probably why I gained more weight too.
Yes. Okay. I'm just going to ask you about your activities of daily living, and this just means, do you have any issues performing just your daily activities like brushing your teeth, getting up, walking, getting dressed, anything like that?
Sometimes it's hard to get out of bed in the morning. I just want to stay in there all day. But other than that, that's fine.
All right. You have no trouble walking or eating or feeding yourself. Okay. How would you feel that you are doing managing your money?
My money, because I haven't been working as much, my parents have been helping me out more. But other than that,
and does that have like emotional impact on you?
Yeah, I mean, I wish I could take care of myself on my own, but right now it's hard.
Do you experience any muscular weakness or fatigue or swelling?
No.
Okay. Any numbness in your body? Okay. And how would you describe your cardiovascular status? Are you aware of any problems?
As of right now, I'm okay. I go for yearly exams, so.
Okay, that's great. Do you have any problems related to your respiratory system?
No.
Okay. Do you have any difficulty breathing or shortness of breath?
No.
Okay. Have you noticed any neurologic changes, like your vision, your hearing, any of that? Okay, so they've been staying stable. How do you perceive yourself?
Well, my self-image really isn't that good right now. I mean, I wish I didn't weigh as much.
Okay. And have there been any recent stressful life events that contribute to your
I mean, just like me not working as much and like my boyfriend and I breaking up.
Okay. Currently, are you dating or married or any?
No.
Okay. Do you feel safe at home?
I do.
Okay. Do you live with your parents or independently?
I live with my parents.
Okay. All right. How do you cope with your fear and your anxiety about the money and your recent loss of your boyfriend?
Right now I just talk to my mom and we talk about how I feel and stuff. But other than that, I don't really do anything.
Okay. That's all right. Have you recently experienced any falls?
No.
Okay. Is there anything else I should be made aware of?
No.
Okay. I'm just going to go through what I have gathered from us talking. So you're here for your ear pain. I forgot to ask you on a scale of 0 to like 10, how would you rate that pain?
Like a 6 or a 7.
Okay, so you're here for your ear pain. That's a 6 out of 7 or 6 to 7 out of 10. And also that you have recently lost your boyfriend and you've been experiencing some weight gain due to that emotional loss and you're not sure how to cope with that. So we can definitely help you with your ear pain and also that loss and the anxiety that you're dealing with money as well. I will give the doctor this information and he's going to be with you shortly. All right? It was so nice to meet you. Thank you, Alyssa. How do I close this? I wonder how long mine was.